felt like your emotions are out of control? Perhaps you feel overwhelmed, or maybe you can't understand why you're sad, happy, crying, but you just seem to feel that way. Mood swings are a common phenomenon, and there is nothing to be worried about. People experience them all the time. However, what happens when it is more than just a mood swing, but a pattern? In fact, your behavioral reactions begin to intrude in your life. Bipolar disorder, also known as manic depression, is one of the most common behavioral disorders in adults and teens, accounting for 3 million cases annually, as stated by the Mayo Clinic. The following will define, diagnose, and describe the available treatments for bipolar disorder. Bipolar disorder is a behavioral disorder where the individual suffers of episodic changes, which consists of mania or hypomania and depression. These episodic changes can be uncomfortable, difficult to handle, and sometimes life-threatening. As mentioned before, BPD fluctuates between episodes. These changes in mood usually consist of irregular but consistent patterns. Mania consists of a high fluctuation of energy. According to the DSM-5, a manic episode is characterized as a distinct period of abnormally and persistent, elevated, expansive, or irritable mood, and abnormally and persistent increased activity or energy lasting for at least 1 week. While the other side is depression, characterized as low energies, horrible low self-esteem, sleep, excessive sleep, overall feelings of self-loathing, and depression. The origin of bipolar disorder can be seen as far back as the Grecian times. However, the actual identification of the disorder did not occur until recently. In an article written by Neil Burton, MD, in 2017, unfolds the origins of this disorder. Burton comments, German psychiatrist Emil Kraepelin distinguished the disorder from schizophrenia and coined the term manic depressive psychosis to describe it. Kraepelin emphasized that in contrast to schizophrenia, manic depressive psychosis had an episodic course. Interestingly, the terminology for how the name of bipolar was formed came from the negative stigma that was coined with the word manic depression. Furthermore, Kraepelin did not distinguish entirely depression with psychotic symptoms or mood disorders, which Burton concluded that the distinction dates back only to the 1960s and is largely responsible for the modern emphasis on bipolarity and hence on mood elevation as the defining feature of the disorder. Bipolar is considered a mood disorder, but furthermore than that, it is dual, which is important because its ability to be diagnosed is by the double nature it exhibits. How do you know when you suffer of bipolar disorder? Usually, ongoing patterns will resonate with the patient, but the most efficient way is seeking professional help. Psychologists and psychiatrists focus on diagnosing your symptoms, classifying them over a series of meetings. As mentioned previously, BPD exists when both mania and depression are present emotions for long periods of time. Although it seems easy to diagnose, BPD can often be misdiagnosed. In a study conducted by clinical professionals stated, bipolar disorder presents several significant diagnostic and management challenges. It may go unrecognized and misdiagnosed. Although symptoms of mania may be more conspicuous, patients with bipolar disorder spend more time with depressive symptoms. This, of course, poses a struggle for the psychiatrist or psychologist because the duality of the condition is no longer there. Therefore, being misdiagnosed, like other disorders similar to major depressive disorder, MDD, or persistent depressive disorder, PDD. Furthermore, the frequency of misdiagnosis is an alarming rate. Dr. Larry Culpepper states, one study reported that patients were misdiagnosed an average of 3.5 times and had seen 4 physicians before correctly being diagnosed. However, clinics and professionals use specific methods to diagnose the patient. The methods include screening questionnaires and overall conversation of the patient's experiences. The screenings involve looking at the patient's history and examining if they are predisposed to any biological factors. Furthermore, questionnaires are utilized to examine the patient's past experience and mood shifts, which become key indicators. Finally, frequent visits with the physician and the patient further allows the professional to understand what the patient suffers from. Although there are complications, there is a possibility of diagnosis. Once the diagnosis happens, what is next for the patient? Is there a cure? Unfortunately, bipolar disorder is a life journey. Similar to other mental disorders, there is no cure, just treatment. Psychology provides different techniques and approaches to aid individuals with BPD. There are techniques therapy can provide. Each have their personal benefits and drawbacks. In a study which focused on psychological intervention on the effect, tests were conducted on the effects individuals experience. Psychological approaches can include CBT and psychoeducation. Cognitive behavioral therapy, or CBT, is the non-pharmaceutical intervention of choice for patients with depression and anxiety, and those with bipolar disorder suffer from high levels of unhealthy personal beliefs about illnesses and dysfunctional attitudes towards medication, which are reduced and improved, maintained over time by an adapted group intervention or psychoeducation. These two methods have years of analysis and research conducted. They are proven to work, especially with patients who suffer from anxiety as well. However, in some cases, it is required more than psychological help. With modern science, it has become apparent that biological factors contribute primarily to the development and the predisposition to different illnesses. This can also be seen with mental health, as depending on the family's history can determine what the patient is predisposed to. In an article provided by OpenStax on the year 2014, mood disorders have been shown to have a strong genetic and biological basis. Relatives of patients with bipolar disorder have 9 times the risk to develop the disorder. Psychiatric help can aid patients through different methods, since mood disorders often have imbalances in certain neurotransmitters, particularly norepinephrine and serotonin. OpenStax states, in the treatment of bipolar disorder, medication blocks norepinephrine activity at the synapses. This medication is the common utilizer to allow people who suffer to rebalance the neurotransmitters which control their emotional receptors. Bipolar is a complex, common, and treatable disorder which requires professional help and medical. Sadly, because of its depressive nature, several patients have been known to indulge in self-harm or even suicide. In a report conducted by OpenStax the year 2014, which spoke about the suicidal tendencies of BPD, patients stated this: suicide rates are extremely high among those with bipolar disorder. Around 36 of individuals with the disorder attempt suicide at least once in their lifetime. Mental health is important and should be kept checked like physical health. Just like a doctor, it is necessary to find a well-certified therapist. Bipolar disorder can be devastating to the individual, and the sooner it is found, the better. This will provide adequate help by professionals and therapists who have experienced the following conditions. If you notice unhealthy patterns in your behavior or find commonalities in the following condition, please speak to a professional.